We're now going to move into the panel presentation on communities addressing systemic racism, followed by a live question and answer. We're excited to have a group of prize community members from across the country on our panel, who were joined by moderator Nicole Bronson from the Robert Wood Johnson Foundation. We pre-recorded the panel discussion in a short video about prize communities a couple of days ago, but the presenters are here live with us today for a question and answer session with all of you. Please use the Q&A feature on the bottom of your screen to pose comments or questions for the panel. They're eager to hear your thoughts and questions, and we'll try to get to as many questions as possible when we bring the panelists live on stage. So let's watch this video.
Hi, everyone. Thanks so much for joining us on our prize virtual events last panel, Communities Addressing Systemic Racism. My name is Nicole Bronson. I'm a Senior Communications Officer at the Robert Wood Johnson Foundation, and I have the pleasure of working on our Healthy Communities theme, which is actually the place where the Culture of Health Prize was born. It's been a tumultuous year for us all. That's probably an understatement. We've seen health and economic crises in the COVID-19 pandemic. We've seen unrest over police force and the use of police force across the country. We've seen some political unrest. Suffice it to say, we are very cognizant of all the sort of trauma and experience that informs the work that's going on today in these communities. And of course, it's one reason we are not meeting in person this year. So just a couple of notes before we get started. We are actually recording this conversation, just so you have it, and we will join you live later for questions. And we will introduce the rest of the panel after a short video.
Tens of thousands took to the streets honoring George Floyd and protesting racism.
The terrible events of this year have driven demands for social justice and inspired a national reckoning with structural racism. These Culture of Health Prize winning communities have long known they must engage in hard conversations about the historical wrongs that perpetuate today's inequities.
You can't disconnect the historical disparities from what's happening today.
For hundreds of years, policies and practices have continued to marginalize minority populations, in particular African Americans.
The superintendent of the park said, "Why do so few African Americans walk in the park?" And I told him it is because they think that the park glorifies the Confederacy.
There are no systems, healthcare, education, economics, criminal justice, that are not affected by racism.
We have to face the history that brought us here, and we have to recognize that we're not going to get out of this by piecemealing the same things that we've always done.
What has to happen is an acknowledgement of the trauma.
We've really had to work hard on this relationship by forgiving how they treated our Native people.
We're really entering this work of disparate outcomes by addressing the root cause of systemic racism.
These are honest conversations about deeply rooted injustices that linger in our institutions and shape our communities.
On the east side, where a lot of our African American families live, and on the west, where our Latino families live, the health disparities, I think, are pretty clear and obvious.
The issue of income, right, is so intricately linked to how long people live and how well people live.
In one neighborhood, a woman can live to see her grandchildren, and in another neighborhood, she will not live to see her grandchildren.
I think right now, the biggest challenge to living healthy for the immigrant community is to live without fear.
We've realized that we need to start talking about health equity and racial justice and social justice.
These are important conversations about confronting systemic racism to create opportunity and health for everyone.
We make sure that we really are getting to the systems that are creating inequities for some of our neighbors.
If we really want to change these enormous disparities, we have to find alignment between the government sector, the nonprofit sector, the corporate sector, and the philanthropic sector.
We're looking to make sure that our kids and our families are healthy. We're looking to make sure that our parents have affordable homes.
We have a vision of economic dignity for everyone.
Because when I got the opportunity, I shined. That's all I needed. I mean, I think that's what everybody wants.
Our Latino community has increased greatly. I see more acceptance of our community, of our language, of our culture in so many ways.
I think that the work to close the gaps of disparity in our community is something that we will continuously have to be looking at.
When we see these disparities with outcomes, you can either accept that as fact or decide to change it.
So we're seeing some great efforts across the country to deal with systemic racism. I want to bring you now to our panelists. Danny Avula, who's the director of the Richmond City and Henrico County Public Health Departments in Richmond, Virginia. Jesse Hikakta, relationship manager of Blue Zones Project in Klamath County, Oregon. Kim Campbell, who's the assistant county administrator in Broward County, Florida. And Frank Thompson, who's a deputy director of the Kansas City Public Health Department. All these folks join us from communities that have won the prize in the past, and we're just going to dig right in. So we've seen, a bunch of activities across the year that really bring this to the fore. When we say systemic racism, what does that mean to you all as a member of your community, and how does it impact the work that you do for your community? Let's start with you, Danny.
Thanks, Nicole. I'll start just by talking about my early days in this work in public health. About 11 years ago, when I started working at the health department, one of the first things we did was map our data and look at, where were we seeing high rates of infant mortality or teen pregnancy or sexually transmitted infection. And invariably, you would see aggregations of disease over the same communities, which happened to be our most densely populated, highest percentage minority, lowest income communities across the city. And I think I had a sense of that going in, but it wasn't really until the next couple of years of unpacking that with communities and talking to community residents and learning the history of this city that I was living in and learning about, where the past of Richmond really helped me understand the systemic forces that contributed to these massive health disparities. The reality that, redlining and what that did for, taking wealth out of Black communities and not allowing African Americans to own homes. The decision to lay Interstate 95 through the most wealthy Black community in Center City, and just devastating the wealth that was accumulating there. Subsequently, the creation of public housing, and then for decades, the disinvestment in those communities, in the schools, in the systems that were supporting those communities. You just recognize that over time, we have made a series of decisions and actions that have created the environment and circumstances that make it really difficult for low-income people of color to be healthy. And so it's understanding that larger context about what's at play that makes up this idea of systemic racism driving health disparities in our community. What does that mean for us? It means that we continue to do the work of engaging communities and connecting with residents and really trying to have resident voice shape the way that we invest time and resources. But it also means that it's more than programs and services, that we're using those relationships with residents to work at a policy and systems level. We have residents of public housing who are showing up to city council, advocating for a tobacco tax, residents who are in the conversation about how the city allocates dollars in the midst of public housing redevelopment. So it really has changed the way that we think about voice and power and the allocation of money to address those systemic issues driving health disparities.
Thank you so much, Danny. And we've seen that across the country, some of those systemic problems you've talked about. Why don't we go across the nation a bit? Jesse, can you tell us a little bit about Klamath County?
Hello there. So coming from Klamath Falls, which is a
pretty rural county. We have 65,000 individuals represented in our county, 21,000 in our urban growth boundary, which is primarily the population that I work with as the relationship manager for Blue Zones Project Healthy Klamath. And when I think about systemic racism, for me, I think about it as just being a process or procedures or policies that have been put into place within an organization so that individuals don't take advantage of a system or a program. And maybe that's been institutionalized and or has been accepted by the culture of the people that work within the organization, and or has been accepted as a part of the way that interactions take place due to the community. And as a nonprofit well-being organization, I think it's different for me when I'm thinking about systemic racism, because I don't have, say, clients particularly that I work with. My job is to try and improve the social determinants of health with individual and or populations here in Klamath Falls. So when I think about our own organization, though we do focus on social determinants of health, it is really hard because as a Blue Zones Project model, we did notice early on that there wasn't a lot of representation for people of color in marketing materials. And when we're trying to reach our population, which we have our tribal population, Klamath, Modoc, and Yahuskin. We have migrant workers because of our farming and ranching. We really needed to look at the way that we were marketing and targeting our populations for improving overall health and well-being, not just for those who naturally came to us, which tend to be white, wealthier community members. We needed to reach all community members because that is our role in improving social determinants of health and well-being. So we really needed to work with our national team on marketing. We really needed to work internally. And unfortunately, we still have a lack in service when it comes to reaching out to our community members. Not a single person on our team speaks Spanish, yet we have a high population of migrant workers. They're the second highest population that makes up Klamath County. And so I see that there's a little bit of a downfall in the way that we're operating. And I think that even when, as a nonprofit organization or social services, when we think about reaching low income or fixed income, we almost automatically assume that we're reaching people of color. And I think that's probably one of the biggest barriers that we can create for ourselves.
Thanks, Jessie. So Kim, why don't you take us to Broward County in Florida and tell us about systemic racism there?
Sure. So when I think about systemic racism, I really think about the structures that are in place that are perpetuating disproportionality and disparate outcomes. So, you know, Broward is in sunny South Florida, just north of Miami, and we epitomize diversity within diversity. We've got island Caribbeans, and we've got African Americans, and we've got Latinx from all over the place. So we are really a rich community in terms of diversity. And not unlike every other place in this country, we suffer from disproportionate overrepresentation of people of color in every one of our systems. For children, it's in the children's mental health system, in child welfare, it's in special education. For adults, it's health disparities. Our African American Black community has the highest new incidence of HIV/AIDS in Broward County. You know, highest unemployment rates, you know, the list goes on and on. Literally in every single system, there's disproportionality. And unfortunately, in all of those systems in Broward, we can control for race and predict the outcomes that our clients are going to experience. And, you know, at some point, not just in Broward, but in this country, you have to realize, you have to come to terms with the fact that there can't be something wrong with all of these people of color. Like literally, this has got to be about the systems and structures that are supposed to be designed to offer support, which are actually, whether intentionally or not, serving to oppress clients of color. And so in Broward, in the local governmental entity, I work for Broward County, I'm Assistant County Administrator. We have made an intentional decision to dismantle racism in our community. We are actively working towards becoming an anti-racist governmental entity. And what that looks like is the establishment of the Office of Equity and Community Investment and a dismantling racism initiative, such that we have brought a 2.5-day training program to our community so that we can establish a common language and analysis about what we're talking about. Because we're not talking about individualized prejudice and bigotry. We really are talking about systemic and institutional racism that is insidious, whether we recognize it or not. So we've trained just under 3,000 people in the last 3.5 years in this common language and analysis across all of the systems, and including members of our community, kids in the, young persons from the local high schools, so that we at least understand what we're talking about and are not working at cross purposes, right? Because language is everything and words really matter when you're doing this very important work. Some of the other things we've done is in the Human Services Department have moved $86 million in funding that we deliver to 3 systems of care across our community to serve residents into the Office of Equity and Community Investment to make sure that the funds we are allocating in our community are made through an anti-racist lens. We have partnered with our public school district, and we have 234 equity liaisons, race equity liaisons in all of our schools. So every school has at least one. Some schools, depending on their size, have 2 of those. We've started an initiative that we're calling Race Equity and Child Welfare, because what we found in Broward County was that Black families were being decimated in 2 zip codes in particular. And so what we did was take our Strengthening Families approach to child welfare, and we laid over that approach an anti-racist lens, which means that we train the investigators and the people that were providing the services to these families in the anti-racism initiative, and then use that as the framework or the backdrop within which they did their work. And what we've been able to do is cut almost in half the number of Black kids that are coming into care. And everybody knows that once you bring children into care, Black children in particular, they stay in care longer and do not experience permanency outcomes that their white counterparts do. So, we're making really good strides at being intentional about addressing those systems and structures that are putting upon families and communities. I think what's most important to recognize is that since the inception of the United States, people of color in the communities that they live in have been seen as pathological. They've been seen as needing services and supports, or not being capable of providing for themselves, or not being seen as having strengths that are inherent to their families and in their communities. And what we're saying is no, that is absolutely wrong. We can partner with community in a way that acknowledges the inherent strengths and capacities and resiliency that they bring with them and have with them. And we can rebuild and reshape our systems such that we actually offer the support they need in the way they need it, in the way that they're asking for it, rather than being intrusive and domineering and ultimately oppressive.
Thank you, Kim. I think that's so important, your points about language and also the hope you offer, because it's not just about the problem, right, but also about moving toward a better way. Frank, take us to Kansas City and tell us about what systemic racism means to you.
For me, addressing systemic racism is about taking a look at historical and current policies and procedures and the racial impact that those have. And it's not just about intentional actions or policies. It requires looking at the impact. If you just focus on intention, then you miss out on a whole piece of how systemic racism really plays out. All of us tend to bring our own biases and prejudices into decision-making processes with us. And if we don't examine policies based on the outcomes, we really miss an opportunity to correct some historic wrongs, whether the outcome was intentional or not. It's really important to focus on what's the outcome that that policy or procedure is producing now. And if it's racially disparate, then we have to be willing to say that that's an example of systemic racism. And for me in particular, I really believe that systems tend to take on a life of their own. And so a policy may have been put in place 20, 30 years ago, may have been totally benign, but as circumstances change, how that plays out in the workplace and in services that we provide to our citizens can have a very definite racist impact, whether that's something like degree requirements for positions or something that is currently struggled with in terms of things like work requirements for assistance programs. And I think when you start looking at the outcomes that it produces, then that makes it a lot more easy to identify what's going on and not get caught up into what was the intent. And it's not about trying to call any individual racist. It's about looking at what's the impact that it's having.
Yeah, I'm definitely hearing that common thread. I think when the conversation about racism began, 10, 20, 30 years ago in earnest, it did feel like a conversation about personal bias. And now we really have moved toward this sense of, no, it's about systems, it's about policies, and the people who, as Kim were saying, need training in anti-racism have actually been trained, whether they know it or not, in racism. So I think that's a really good point to make. So I want to move to our next question. And obviously, I'll just state the obvious here. We're all people of color on this panel representing various institutions across the country, and myself included, philanthropy. Many of us operate in these two different spaces in our communities, both as representatives of the systems that we talked about, the very sort of systems of authority and, sort of control in our communities. But we also have our own identities, and sometimes those very identities are sort of can be oppressed by those systems. So I'd love to hear, especially from Jesse and Kim, how you navigate and work through this, those two different roles and try to change those systems. I don't know, Jesse, if you want to start us off.
Sure. So as I had mentioned before, I do work with several different types of sectors within our community, whether that's city or county governments, school administrations, health professionals, social service organizations. So these are all organizations that certainly we tend to tie systemic racism to. And these are all organizations that I need as community partners when I'm talking about social determinants of health. And as much as I don't necessarily value being brought to the table to represent people of color, I do see the value in it. And I am very honored when I'm asked to come sit at the table and look and strategize and try and create new ways of working with individual people, new programs that could be implemented, asking to do outreach alongside a certain organization, because I do know that individuals, when they see somebody that looks like themselves, they're more willing to listen, and they're more willing to accept assistance, and they're more willing to trust. And that's exactly what these organizations, these sectors or systems need, is a spokesperson. And so I can be at the table, and I can at least help. And most of the time, I don't necessarily think about myself as being that person of color. I'm an enrolled tribal member. I am Modoc and Paiute, and I get called to the table often to represent the Klamath tribes and or other other individuals of color. And, I don't want to say that I know all of the answers, but I do have to say that as a professional, at least I am recognized as a professional, I'm recognized as a peer, and my voice can be heard for those whose voices cannot be heard, and I can hope to help make change.
Thank you. Kim, how about you?
So I am a survivor of the child welfare system. And I was adopted by a white family who threatened to sue the public child welfare system in the 60s because they didn't want to let them adopt me because they're white and I'm Black. That same family adopted a Native American son. So I have the privilege to have grown up in a multicultural family with parents who worked literally my entire life as long as I can remember towards racial equality. So that's the frame that I just grew up in, right? And I watched them exercise white privilege, not even knowing, just watch them move in the world. I could see that they had access and deference that I didn't have, even though I was with them. So, we had lots of conversations about what it means to be Black and what it means to be white as I was coming up. And so what I would say to you is that I bring my whole self to the work, my whole self. And my father said, you have to be bold and audacious in the face of adversity, and you have to be fearless in action. You take a stand and you do what's right. And what I believe is right is addressing systemic racism. I've been a social worker 25 years, and I've seen a lot of good work done with individual families and sometimes in small neighborhoods, but I have never seen deep and lasting change that is required to elevate us all such that everybody's standard of living and comfortability is impacted. And I believe that the key is addressing systemic racism. So I am unapologetic about it. I feel like you have to name it. You have to be brave about it. And if I'm seen in the room as the angry Black woman, so be it. I don't give a damn. I really don't. So, I think bravery is required. And I think that, when you're in a position of authority with access to resources, which I am, I have a responsibility to eloquently and adequately convey what I'm hearing in the communities of color. And I do that with pride, and I do it with humility, and I do it in such a way that we can advance this work to the greatest extent possible. And I have been known to say in many forms, and probably said it on the Robert Wood Johnson stage at some point, I will do this anti-racism work in Broward County until we successfully dismantle racism, or I'm run out of town on a rail, whichever comes first, and it doesn't matter which, I will keep going.
Wow. Well, thank you for sharing that. I mean, I feel like you dropped the mic on that one. I had no idea of your personal experience in the system, and that's just, it shows even more why you're poised to really make this change, right? You're sort of living what we've been talking about, that people in the systems have to make the change. So thank you for sharing that with us. So we're going to move on to a question about the public health side. So Danny and Frank, you all are public health leaders. So you often come face to face with the barriers of opportunity that we see with systemic racism, health disparities, unhealthy living situations, et cetera. And you talked a little bit about this in your intro, but could you tell us a little more about broadening this notion of health? How do you shift the focuses away from the people and their choices, and really to the conditions that they're living in, and again, those policies and systems that contribute to the choices that they have? Dan, you want to start us off?
Sure. Well, I will say that I can't count the number of times that I've used that graphic from the University of Wisconsin that RWJF funded that talks about what are the drivers of population health. And that 20% healthcare, 10% built environment, 30% health behaviors, and 40% socioeconomic factors. I've shared that with so many people and partners over the last, 5-7 years, that has given people a tangible tool to understand health outcomes differently. And for most people, most audiences I share that with, it's really eye-opening for them. And so I think part of it is a framework, part of it is the data. When we start to lay out public health data, there's a presentation I give where we look at the communities in Richmond that were historically redlined, and we fast forward 70 years and we look at what are the health, educational, and social outcomes in those, mapped across the city, and you see the hotspots in the same neighborhood 70 years later. It tells a story and it helps people connect, man, health isn't just about whether you have access to a doctor or not. There is a history and a context that we have to think differently about. And so I think data has been a powerful way that we've changed the narrative here in Richmond. And I think our work has reflected that. In the early days of us working in public housing and hiring community health workers, the community health workers were taking a very holistic approach to the way that they would navigate residents to care. They would think about, why is this person not showing up at the doctor? Is it a Medicaid coverage issue? Is it transportation? Is it that they have other kids and they don't, can't figure out childcare to free them up to make? So they were applying that lens in the work that they were doing in navigation to healthcare. But the work of the community health workers has evolved far beyond, can I get you to the doctor or not? As I mentioned before, these folks are sitting on boards and at leadership tables and advocating with council members. Our community health workers in the East End were instrumental in bringing a grocery store to the East End of Richmond. And one of our community health workers actually sits on the board of that grocery store and has had a lot of influence on, what services, what were the focus of that grocery store, how much were they going to hire from within the community. And that voice has come from, the expertise of this community health worker and her peers being recognized and having the pedestal to actually use that expertise and influence. And so I think that's also true in the housing conversation in Richmond. We've had some pretty terrible examples of housing redevelopment where folks have just gotten lost in the process. And I think the elevated voice of public housing residents in this era of public housing redevelopment has really helped the housing authority shift to an understanding of, we've got to be people first as we think about where money is going, how we're redeveloping, whose voices are shaping this process. And so our community health workers, we have another core of residents called family transition coaches that have had really a super important voice in shaping a people first vision of redevelopment in Richmond.
Thank you so much. Frank, take it away. Tell us about Kansas City.
For us here in Kansas City, this discussion about racial equity has been a 20-year evolution in terms of discussion. Starting when our current director was hired on, and about 6 months later actually recruited me to come here to Kansas City. And one of my very first assignments was overseeing the publication of our first ever minority health report for the city of Kansas City, Missouri. And in that, highlighting some of the racial disparities that existed in the city, and then the conversation evolving from there to really begin to talk about life expectancy gaps. In that first report, there was a 12-year gap between our Black population and our white population. Over the years, that unfortunately has expanded somewhat. And even looking at it geographically, within the city, we have zip codes and neighborhoods that are less than 5 minutes apart, where there's a 17-year gap. in life expectancy, and beginning to then have the conversation, well, what's causing that? It's not just whether or not people have access to medical care. We're actually fortunate as a community. We have a local health levy that actually provides funding to our local federally qualified health centers and to safety net hospitals to ensure that everyone has who's uninsured or underinsured has access to medical care. But that does not in and of itself create health. And so having that deeper conversation about, okay, what are the social determinants that go into defining health? And likewise, we have on multiple occasions used that Robert Wood Johnson graphic of here's what everything contributes. And when you look at the contributions for medical care, it's only a small portion of what determines our overall health outcomes. When moving the conversation further on to really begin looking at racial inequities, this health department is actually built on Troost Avenue here in Kansas City, which is the historical dividing line. East of Troost was where Black folks lived. West of Troost was where the white population lived. And the building was built here quite intentionally. It wasn't an accident. And just in recognition that one of the roles of the health department should be to begin to bridge that divide and begin to highlight those differences. So we have gone from that discussion about health racial disparities all the way to the most recently seated council that took office a little over a year ago. Two members of that council who have been very active with us in terms of legislation. One to acknowledge racism as a health crisis here in Kansas City, and also drafting legislation to create an office of racial equity and reconciliation that we're currently in the process of trying to find funding and get started up. The most recent CHIP, 5-year CHIP, community health improvement plan we did was totally based on social determinants. There were none of the traditional medical care items of we're going to reduce hypertension or we're going to reduce diabetes. It was all focused on social determinants, economic opportunity, on education, on issues around the built environment, including housing, on violence as a public health issue. And we have a program within our department that is an evidence-based national model from the Cure Violence program out of Chicago. Our program here is called Aim for Peace, but really looking at violence not as a law enforcement issue, but as a public health issue. And a need to address it like we would any other communicable disease within the community of how do you identify the sources, how do you isolate, how do you stop spread, and really intervene in that kind of a mechanism. Over the last couple of years, we've gotten a lot more engaged on affordable housing initiatives. And initially, there was some pushback on that in terms of, well, you're stepping outside of your turf. That's not really an issue you should be concerned with. And having to go back and again, engage in that discussion about social determinants and talking about the impact that housing had, and in particular affordable housing, has on health outcomes within the community. It's been real interesting, especially over the last 5 years or so, after years and years of us talking about life expectancy, social determinants, and almost feeling like we're standing alone on that issue, to now seeing other departments as they bring forward programs or propose new services, beginning to also echo that language of, well, this is about improving life expectancy, or this is about addressing the social determinants. So it's been a long journey, but it's been interesting to watch it from my perspective. From going from being kind of the only voice out there raising the issues to now seeing everyone around you. And even more recently, we've been pushed. We're part of a project by City Match called the Best Baby Zone. And it's challenging communities to look at infant mortality and maternal mortality in a different light, not look at it from the traditional medical care model, but really look at it in the context of racial inequalities. The project really pushes all of its participating communities to address that issue as being at the core of those disparate outcomes we're seeing, and really addressing that issue head on.
Well, thank you, Frank. I think what you're telling us is that you've been doing a good job, because now it's not just you spreading the message, right? Everybody's doing it too. That's great. And we're seeing that across the country, which is really great. So we're going to wrap up with one final question for all of you. As we talked about at the beginning of the panel, you know, it's been a crazy year. All of your past prize winners, and you know, we've talked a lot about your communities, and sort of it's almost a sort of retrospective about, you know, you're winning the prize. What have you learned from your experiences in 2020 that will impact your work going forward? Let's start with Danny this time.
Thanks, Nicole. So kind of one example during our COVID response that I think will stick with us is that there's a big difference between reaching out to communities, particularly non-English speaking communities, with staff who are bilingual versus being bicultural. You know, the ability of a recent college grad who maybe spent a semester in Barcelona to be able to connect with residents as we're navigating them through this COVID response is really different than when we've started to hire community health workers and residents of those affected communities who can just connect with and you know, have a different type of credibility with their peers. So that's been really important for us to understand the cultural connection with our non-English speaking communities. And then on a macro level, you know, Richmond has made national headlines because, you know, as the former capital of the Confederacy, as a place that, you know, physically we have this Monument Avenue that has, you know, 50 to 100-foot statues honoring, you know, these so-called heroes of the past. And, you know, our mayor has been pretty clear about his position about wanting those to come down over the years, but the community was not there. And the power of organized community voice in the midst of this time, this crisis, has been so, it's galvanized such an important movement. And all but one of those statues have come down at this point. One of the remaining statue is state-owned. And what has happened around this huge Robert E. Lee statue is that it's been taken over by community members, mostly African-American residents. It's all graffitied up. They have planted gardens. They have put up basketball hoops. They're hanging out in tents. And, you know, these are Black residents of our community who, you know, even in recent history would have been stopped about what are you doing in this part of town? And now they're saying, no, we're here. This is our place too. We matter. And they're just using their voice in a way that is pretty unique to our community. So I would say that the power of organized community voice is changing our city, and we will continue to look at ways that continues to be a part of our work in public health.
Thank you, Danny. Frank, what about in Kansas City?
I think there are a couple of lessons that I'll take from 2020 going forward with me. In my lifetime, I've had the opportunity to kind of watch from afar as other nations reach that critical turning point where people felt compelled to take to the streets and demand change. And always wondered when is that going to happen in this country? When is everybody across the board going to recognize that things have to change and really be willing to take to the streets to demand that change? And to see that happen this year was was a real special moment for me. For me, it was on par with watching the Berlin Wall come down, watching Nelson Mandela walk out of prison and become president of South Africa. What I've seen happen in this country over the last year, as we've seen the protests around police violence and other issues as they've swept the country has really been on par with those historical events for me. The other thing that is always going to stick with me is that need to address these racial inequities, because it's fundamental to the survival of our city, of our state, and our nation. As we saw with the essential workers, people who were forced to put themselves in harm's risk because they were required to keep our systems running. And that we have an obligation to them that never again will we ask them to do that, that we will make sure the systems and resources are in place, that when we ask them to step out and keep our systems running, that we can protect them and make sure that they are safe in doing that. We failed miserably this time, and shame on all of us if we do it again.
Thank you. It's so important to sort of realize the failures and move forward. Jessie, would you like to talk about Klamath County?
Sure. So moving into 2020, it's really been opened my eyes to the community that I've grown up in, that I've been a part in. All of my life, I've always known that we've been a conservative county. I guess it just didn't, it wasn't as glaring because some of the tensions that I felt were when I was younger, being a tribal member. But, you know, as we moved into 2020 with the pandemic, I realized that we have a lot of conservative individuals who don't care to wear masks because whatever it feels like it represents for them. And also thinking about protests. Never, well, once in our community have we had a large protest that I remember when I was younger. I was actually asked to step out of school because it was going to be threatening to the native students there. And but as an adult, watching a parade downtown, just 2 days before we had some protests that were happening all over the nation around, you know, racial equity and police violence. Watching that online live on one side, and then watching our conservative community members carrying guns and bats and flags. It was just very interesting to me to have this so glaring and in our community. And being in a nonprofit organization, I really don't have a voice about what one side or the other I will stand on. So that is one thing that I've learned in 2020, is that as a nonprofit and an individual who works for a nonprofit that represents the entire community, you don't really have a say which way that you go because you represent the entire community. But what I can say is that I've seen a lot of our community partners being asked to step up and be a part of that change. Our community government systems, law enforcement, for example. And I'm really hoping that, you know, they take on this challenge and not be scared about the conservative population that represents Klamath Falls and Klamath County. Already our city government has created an equity task force to try and begin addressing the systemic racism and then, you know, police brutality. I think that was a necessary first step. And I'm hopeful to see where those conversations go in the future. The Klamath Tribes has our Youth and Family Behavioral Health Center, and an individual named Monica Yellow Owl has been doing a lot of presentations just recently. You know, people are very curious now. They're wanting to bring on some trainings. And so she's been offering Klamath history of the Klamath tribes and our history here in the community. And I'd just like to see that more. And I really do want our community partners to step up and start being a part of the change, because I certainly can't represent health and well-being of community members when our community partners aren't leading the way first.
Definitely. So Kim, what from 2020 are you taking forward?
So what a ride, right? It's been a crazy year. And there are so many lessons. I have to say, as difficult as this year has been, I feel extraordinarily blessed to be living in such a time as this, because it feels like we have converged to advance the needle on equity in the United States in a way that carries the torch beyond what the civil rights movement in the 60s has done. So that is very encouraging and energizing to me, even in the midst of what has been an incredibly challenging year. I think, you know, people of color experience their health disparities in the shadows. And we can talk about the numbers and, you know, the disproportionality and the disparate outcomes, and they're just numbers. And what COVID-19 did for us was bring front and center to the fact that health disparities kill people. People die. And so that happening at the same time, that kind of health violence that COVID-19 is happening at the same time that police brutality is coming to the forefront, both happening at the same time in such a way that what I'm clear about is that community voice and the momentum that happens at the grassroots level can be leveraged to advance systems and the work that we do, right? So as a result of community action, we are creating a criminal justice review board. And we're not going to just look at allegations of misuse of force and police misconduct. We're going to look at over-policing in communities of color. We're going to look at the incarceration rates. We're going to look at sentencing across our districts in our county and the disparities within those. We have also decided to create a race equity task force that is made up of a cross-section of our community in order to hold us accountable to becoming an anti-racist organization. So it's really bringing voice, community voice, into government in a way that holds us accountable for outcomes. You know, there's something going around, you know, on social media that says something like, it's not enough to be quietly non-racist. Now is the time to be vocally anti-racist, and that really is true. We have to take advantage of the momentum and that we're experiencing right now, and we, you know, what greater time than this to really dedicate our resources towards this issue, right? Like, we can redirect our resources and our efforts to the extent that we create partnerships that can really result in lasting change, unlike anybody's ever seen before. And the Generation Zers that are coming behind us will take that and run with it, you know, leaps and bounds. But shame on us if we go back to sleep. Shame on us if we go back to sleep. Now is the time.
All right. Well said. Well, thank you all so much for sharing your stories and your experiences and your time with us today to discuss addressing systemic racism in your communities. Thank you everybody in the audience for watching, of course, and we will now join you live for some questions.
Hello, everyone. Thank you for joining us today. And I just want to welcome our panelists back to join us live for questions. My name is Ashley Wilson, and I have the pleasure for sitting in for Nicole Bronson today. I don't know about you, but watching that recorded conversation was so incredibly enlightening to me, and I hope it was for others. Now we'd like to open it up and spend a few minutes taking questions from the audience. If you have a question, please feel free to use the Q&A feature at the bottom of your screen, and we'll get started. So Katie noticed that the Broward County is so far along in a lot of its anti-racist approach work, and it's so impressive. So she just wanted to know who drove this work. Was it staff, elected officials? Was it the community at large? And then just in general, what has the reaction and the response been?
So, actually, the anti-racism work was sort of launched by our local school district, who consulted with a group of folks out of California to do some training with their leadership on anti-racism approaches within the public school system. And then our Children's Services Council, who participated in that, decided that it would be useful for our community to engage in this work outside of the context of education, specifically, and address it in general. And they looked for system partners to partner with them in the funding and implementation of the training. And so the county signed on, and ultimately the Department of Health signed on, Fort Lauderdale Police Department signed on. So we have several now. Broward Sheriff's Office has signed on in terms of a financial commitment to seed and advance the analysis work that's being done. So it's evolved into a wonderful cross-section collaboration, and Broward is really known for its collaborative initiatives. We do everything together in partnership. We recognize that no one system can be successful alone, particularly in this regard. And so it's just been a really nice journey of people attending the training, getting galvanized and on fire about the potentialities that exist doing this work, and have made a financial commitment such that we've been able to reach so many thousands of people in our community, and we're expanding our partnerships every day.
That's great. I find it so impressive that it really came from the school system, because I think that's where we can really help to do some good. It's that part of that education part. So my next question, I want to start with Danny and then go to Jesse. Allyship has come up a lot over the past couple of months. And we just want, and what that means, what that looks like. What do you think are some of the best ways that white people can be allies to communities of color?
I think stepping out of the way is one of those ways. I think we historically have just had white-led institutions across local government and health systems and other sectors. And so, one of the things I've seen happen in the Richmond region is a recognition of that, and a kind of an honesty about what our boards look like and what the heads of our organizations look like. And so there's been some deep work really spearheaded by the Richmond Memorial Health Foundation, who's one of our great philanthropic partners here, to develop a leadership program for folks in the nonprofit sector primarily, to look at their board composition, to look at who their leaders are, and really to encourage the advancement of minority voices and power across those different types of institutions. So that's one clear way. I think the way that we've tried to do that in the health department is to recognize the expertise of our community residents. And I think the community health workers that I talked about are probably the clearest example of that. But what has become almost second nature to me is when people reach out to me or one of our other senior leaders for an answer, or to speak at something, or to chime in on a decision, I will always bring in a community health worker or somebody who's more knowledgeable and closer to the work, and allow them to share that voice and expertise, because frankly, it matters more than mine.
I think the people in the chat have really been echoing the importance of community health workers as well in this work. Jesse, do you have anything to add?
I think when I'm thinking about what can individuals do in support and allyship, I really come back to understanding the history. And when I think about Klamath County, for example, individuals, whether they are white or part of the tribal nation, or even the migrant workers that are here, or even the Japanese internment camps that we had, we really need to understand the history of our community and how we all fit together and how we all ended up here in the first place. And I think that when we can understand the history of our community, we can start seeing how we fit within this puzzle. But then understanding the individual history of, why might we have a Japanese population in the area? And it's because we had internment camps. So looking into and peering into that history of the Japanese culture, why do we have migrant workers here in our community? And it's due to our large farming and ranching communities. Looking into that history and that culture. And the tribal culture, we've been here for time immemorial, and what does that mean? And how long have we been here? Where have the ancestors roamed? That encompasses Klamath County in itself. And then individuals who have migrated here for whatever reasons. I think that we really need to understand each other in a different way than just what we see on the outside, and really look at the history of it all. And I think that can start creating a little bit more of that allyship and recognition as we are here as a whole community. But I also think that when we're asking individuals of color to be represented at say a local government level, or even in partnership with the public health department or other social service or agencies, I think that we need that invitation to be true and to be honest, and not out of, I have to meet some sort of policy requirement, or it's now in my community health improvement plan that I have to reach this population within the next 3 years. It really needs to be an honest relationship that you're trying to build for a lasting change. And I think that a lot of individuals of color and agencies of color, and I'll just speak from, as a tribal representative side, when you're asking me to come represent a population, and I can tell that you're not being true and honest about it, I get offended. And that's not the best way to start moving forward in a relationship. It needs to be true and honest.
I think all that is so important, both the history, but I think also that personal history that has been echoed throughout this conversation about bringing your whole self, and the people making space for your whole self. That personal history is so important. And my next question that we have, I want to direct this to Frank and Kim. Communities across the US are at different points in their journey to address systemic racism. What are your suggestions to communities who may be at the beginning or even in the middle of this journey? What would you advise them to do, Kim?
So the first thing I would say is that while it might appear that Broward County is leaps and bounds ahead of everyone, we are at the beginning. All of us are together in this at the very beginning. It took 400 years for this country to build what we know as institutional and systemic racism, and we're not going to dismantle that in the 4 years that we've been doing this work, surely. So I would say that, what I said earlier about no one system being able to do this alone is really true. You have got to establish relationships with community, with the people who are directly impacted by systemic and institutional racism, and by elected officials. You've got to include people with positional power and access to resources, and that together you build this coalition that begins a movement that's very, very small and slow at first. And you learn the lessons along the way, pay attention to the pitfalls, and use those to springboard your next move. It is very challenging work. This is very hard work, and it takes commitment and it takes bravery. You cannot quit. It is not for the faint of heart, and though it's hard, you can't quit. So lean on each other, leverage those relationships, learn together, Just because you go through a 2.5-day training doesn't mean you're an expert on racism. The analysis is deep because the issue is deep, and it takes a commitment to deepen your analysis and continue to learn and grow as you're doing the work.
Very true. Frank?
I would just echo everything that Kim said. It definitely does require a commitment, a long-term commitment. As I shared in my comments in the video, this has been a 20-year journey for me and my role here at the health department. And yet we are just now at the point of beginning to look at creating that Office of Racial Equity and Reconciliation. So I would say to individuals that are looking to engage in this work, be prepared for the long haul, make that long-term commitment. This is work that has shadowed me my entire time here. Even when I had other responsibilities, I spent 8 years running our Ryan White care system, but even within that, looking at issues of racial equity. So I think it's yes, get the training, educate yourself, but build those relationships, because that's what's going to sustain your effort over the long haul, is those relationships and being able to come back again and again to those relationships.
Yeah, that is the relationships, I think, as everyone has said, are what's going to, it's that trust that you have to build before this work. Exactly. And during this work and throughout this work. And so one of the questions that just came in, which I want to really open up, it's what do we say to those people who say move on as we're trying to address systemic racism? From a systemic, from this perspective, why is it not only disingenuous, but also dangerous to just move on in this work? I want to throw that back to Kim, and then I'll take a moment to check in with others as well on this, because I think this is something we can all speak to.
The move on comment is a manifestation of systemic and institutional racism, right? The only group of people that have been told to just get over it and move on are African Americans who are the legacy of slavery. And you don't hear Holocaust victims being told to get over it and move on. You would never hear that. It's unconscionable to think that you would actually say that to somebody whose family members were victims of the Holocaust. And I think that because Black bodies are not seen as valuable, there is this expectation that we should just forget that legacy and just move on. The thing is that this country was established on racist principles. The fact that you can have a constitution that considers a human being 3/5 of a human being means that it was established on a foundation of racism. That's just the bottom line. And so when slavery is abolished and you have Reconstruction, you've got issues of systemic and institutional racism. And then you've got Jim Crow with evidence of systemic and institutional racism. And I can go on and on about the legacy of such. We are still in 2020 victims of systemic and institutional racism. There is nothing to move on from because we are currently experiencing it every single day. So no, not going to move on. We're going to dismantle this. One way or another, we have got to come together and address this so that nobody has to just move on and swallow their personhood and their humanhood to exist in a racist structure. No way.
Frank, Annie, Jesse, I think that we get a lot, but I just want to hear what you say to those people who say move on.
I'll just provide a quick clinical analogy. If we have diagnosed somebody with cancer, we don't go in and take out part of the tumor, right? It's so prevalent in all of our systems and practices. And until it's all gone, we need to continue treating it.
Jesse?
Yeah, I think that the comment of moving on, this happened so long ago, is really insensitive to current situations, because when we think about when we say, oh, this happened, 100 years ago, 150 years ago, and then today it isn't relevant, that isn't true. And this is why we specifically talk about historical trauma, we talk about generational trauma. When I think about my own family situation, for example, in the Klamath tribes, my great-grandparents and their parents were put on reservations in their time. My grandmother was stripped of being recognized as a tribal member in her time, and lands taken away, reservations that were given and lands taken away. My mother was born in a time where there was no recognition that Native Americans even existed here, and today I experience prejudice. This was only 2 generations ago. So it isn't that far from people's hearts today. And there is no moving on from that.
Thank you. And Frank?
To folks that say move on, I say we live in a society where progress really is dictated by access to resources, capital, and the ability to control those. It's an analogy I often use is it's like a relay race. First 3 legs of the race, one team is cheating or disadvantaging the other team in multiple different ways. You finally get to the last leg of that relay race. Is it really fair to turn to that runner whose team has been knocked out of the race, abused in multiple ways, and say to them, okay, just get past it and run your leg. Even though you're multiple laps behind, just run your leg of the race without offering some kind of redress to that. I think that sense of fair play is something we all recognize. In the analogy I just gave, most people would agree, okay, the team that was cheating gets disqualified. That's not even what we're talking about when we say let's address it and acknowledge what has happened. Let's talk about really addressing how we create a level and equal playing field for everyone, and then we can move on. But until we create that level playing field, it doesn't make sense to say move on. And I say that as someone whose mother grew up on a sharecropping farm in rural Texas. And for me to be where I am now is I think a real obligation for me not to forget that, and for me to work to move this issue forward.
Thank you. I think that was one of the best ways that we could have ended this panel. I apologize. I did go and turn my video off just to make sure that I didn't end this panel by getting kicked off of Zoom or having any other virtual problems. But I think that's one of the best ways to end this panel. I thank all of our panelists for coming, for sharing, and for being so open with the work that they're doing. And I thank all of those who joined us today. And I will turn everything back to Frank.
Thank you again. That was incredibly powerful, very compelling stories, experiences, and questions. Thank you.